what are some of the biggest challenges cancer centers face in recruiting, but then also more importantly, retaining that talent when they have it, to walk these staircases, so to speak?
Oh, absolutely. It is a highly competitive environment for both recruiting and retaining top talent for all specialties, but particularly with specialized areas such as cancer. And in these difficult times, there's a growing concern over the loss of experienced academic faculty. So I want to provide a bit of a perspective around the landscape, as this is an ongoing challenge, both to an increase in demand but also a decrease in supply of providers. So we all know there's an aging population, and that both increases the patient need for cancer care, but it also affects the available providers to deliver this care. So the oncology workforce is aging. According to ASCO, 1 in 5 US oncologists is 64 years of age or older and nearing retirement age. In addition, the median age of oncologists engaged in patient care today is about 53 years old, and less than 15% of oncologists are younger than the age of 40. So that, coupled with our aging population of the patients and what we found in our recruiting trends in oncology, we expect that by 2040, about 1 in 5 Americans will be over the age of 65. And that is up from about 25 years ago, when that was 1 in 8 Americans. And according to the National Cancer Institute, this advancing age of Americans is really the most critical risk factor for cancer overall. Leads me to my next point. The cancer is on the rise. The World Health Organization is predicting that by 2050, there will be about 35 million new cases of cancer. That's a 77% increase over the estimated 20 million just about 3 years ago in 2022. And the reasons for this is that we've got some improved survival rates, reflecting advancement in early detection and treatment. The 5-year relative survival rate for all cancers has increased from about 49% back in the mid-1970s to about 69% in the last 10 years. So certainly, just to kind of sum up all those statistics, our biggest challenges likely are due to, the increase in demand and the decrease in supply of our providers.
Yeah, and we need more people. That's the key thing that you've mentioned there. These statistics are so jarring when you think about it. It's one of those things that's, when you put them next to each other, you start understanding the correlation. You start understanding the bigger picture of this. And Joel, I'd love to get your perspective on this as well. Obviously, you've heard the statistics, you're aware of the statistics, but in general, some of the challenges that firsthand that you're experiencing in terms of recruitment and then also retaining that top talent.
Well, again, I certainly appreciate the supply side problem that we're facing, the demographic cliff that we have ahead of us. But, if you're a leader of a cancer program, recruitment is important. But I think long-term success is largely impacted by your ability to retain top talent. It is much more costly over the long term to manage attrition, manage the gaps and interruptions that creates in your clinical programs or your clinical operations or your research programs or what have you. Retention needs to be a top of mind issue. And, retention isn't always compensation. It's quality of work life. It's accommodations for family. And as my colleagues from AMN will tell you, expectations by generation are very different. And a lot of the younger trainees that we have coming into medicine looking for their first initial appointments or their first promotions into leadership positions, they have a very different expectation about, how much time they get to spend with their family, how much investment in their professional development and their work-life balance they want to see from the organization. So I cannot emphasize enough the need for organizations to stay ahead of that. Failing to stay competitive in the market, obviously it's a huge setback. Failing to stay competitive from a compensation standpoint, I have an adage that, you know, you need to pay people their market value or your competition will. And we certainly see that. If you are in a major urban area, let's say the city of Philadelphia, we have 3 NCI designated comprehensive cancer centers. So if you want to have an academic career in oncology, you've got options. So we are continually competing with, you know, within our own backyard for talent. And what we are trying to do where I'm currently at is just make this the best place to work. You know, have our staff feel emotionally invested, aligned with the mission. We have launched a variety of activities to improve employee engagement. We're starting to see the fruit of that. Nursing turnover is plummeted to a very, very low level. You know, tip of the hat to our Chief Nursing Officer, Anna Rodriguez. She's done a fantastic job of that. But, you know, we're trying to make this to be the most attractive place to work for people who want to have families. As another example, we have our own daycare. Sounds like a small thing until you have, you know, infants or young children and you have them 2 blocks away. It's a wonderful asset for us that makes us a differentiator in the market. So again, it's important to be able to recruit. It is doubly important to retain.
Yeah, and I love this shifting mindset too of, yes, obviously, as you've touched on, compensation is important, but then, like you said, these added on benefits, right, that are really, that maybe 20 years ago weren't that big of a talking point are now becoming more important than ever when you can offer them to folks to be able to do that. And Alan, would love to get your thoughts here as well on this, and certainly as a reaction to what Joel was saying, but also some of your thoughts on the recruiting piece, but then also the retention piece.
Sure. Yeah. No, I really appreciate Joel's comments. I mean, I think the retention piece is so important, and I think just to focus on one's work-life balance is really important. You know, there's another aspect that I'd like to highlight as well, and that's really thinking about our patients who receive care outside of major academic medical centers. And I think most cancer patients receive at least some of their care outside of the major academic medical centers. And so we need to think about the challenges for our patients in community centers, community settings, and in rural settings as well, because, you know, the workforce for oncology, and by workforce, I mean physicians and, you know, really the entire workforce team, is heavily concentrated outside of urban areas. And so this is really a challenge that we need to think about, so that when we talk about solutions, there's also a focus of people getting care where they are, you know, home care, things like that. We need to really think about our patients who live outside of major cities as we talk about solutions going forward. So just wanted to introduce that concept as well. And as we talk about, you know, as we go through the webinar, I'll try to, you know, bring in the idea of rural and outside urban areas as well.